Balls Deep.
Welcome to Balls Deep, a humorous yet informative medical show with a mission of optimizing your performance in the bedroom, the bathroom, and the boardroom. I'm your host, Dr. Joe Pazona, a board-certified urologist and CEO of Pazona MD. We hope you enjoy. Now, let's jump right in. Hey, Stream Team. Welcome to another episode of Balls Deep. Dr. Joe Pazona, as always, with the lovely Kat Williams.
I am still here.
Yes, you are.
I am still here, and I am cold.
You are constantly
cold. The room
cold.
is freezing, but yes, I am always cold.
You're wearing one of your infamous
summer sweater. It's a thing.
Yeah,
it's a thing.
Something that guys from the Northeast have never heard of.
Well, as soon as they come out with summer coats, I am on board.
Ah, dear Lord.
I am on board. But that is not what we're talking about today.
No, but speaking of being cold and temperature issues, we're going to talk about menopause and hot flashes.
Ooh, okay.
Yeah, and more specifically, hormone replacement therapy in women. Probably one of the most controversial topics in healthcare, if I can be honest. And as a caveat, if you want to deep dive into this, this is not your episode. If you want a good 30,000 foot view of my thoughts as a humble plumber who helps women with hormone imbalances, and you want to laugh a little bit, then this is your place.
Stay tuned.
So, but we'll get a little bit more sciencey than we have in some of our others. Actually, okay. I've got some notes here to.
Oh Lord, he's made notes. I'm scared.
Yeah, exactly. So, with that being said, let's go into the meat of our show. We like to call
Balls Deep.
All right. Well, Kat, where do you want to start?
Menopause, I guess. When does this happen? When does this start to happen? What symptoms, what things do women begin to notice? This is something that is never, ever talked about, not between women, not with our OBGYNs. It's really behind the veil. Mm-hmm. Why is no one talking about this?
Yeah, this certainly falls in the category of things you learn about once you start suffering, and you ask your mom or grandma if they happen to be around when you're going through it.
Sure.
Or you go back and go, oh yeah, now I understand why mom was always turning down the air conditioning.
But no one talks about this.
And it's a shame. And we're going to get to why nobody talks about it. So interestingly, menopause is a certain event that's going to happen in a woman's life, but we have no idea when. And even the definition is kind of a bit vague. You don't know you're in menopause until it's been a year from your last menstrual cycle. So even as you're going through it, you don't know until you're like, oh, I guess it's been about a year. And if we look at perimenopause, which is this period of chaos, for lack of a better term, with a woman's hormones and her body, that can last a couple years to even a decade.
Really?
And this happens to some women in their 30s. And for some women, it's, I just kind of, was in my 50s. And one day I realized I hadn't had a period and I was fine. So although it's this certain event at which really what's going on is the ovaries just go, I'm done.
We're tired.
We
quit.
We are tired and we are out.
We quit.
Unlike men's testicles, which kind of slowly fade over the years.
Do those things ever quit is the question. Sorry.
And some men, no. But in a woman, the ovaries at some point are going to stop. And what are the ovaries producing? Well, they're producing a bunch of hormones. And the two most important of which are estrogen and testosterone. So one tidbit I know I've shared with you before and you found fascinating, women actually make more testosterone than they do estrogen.
Which I don't think anyone is aware of this.
The issue is that women have about 20 times lower testosterone levels than men. So it's not that your levels are zero. It's just yours are kind of hovering at this nice kind of cool, calm level, that make you the wonderful creatures that you are.
Creatures that we are.
But when it goes to zero, during menopause, along with estrogen, we see a lot of effects. So what are the symptoms? Well, certainly the classic one is going to be hot flashes, right? And so what's happening there is there's, again, various hormone and nerve pathways and even our temperature regulating system up in our brain. It's all impacted by estrogen. And so when that throws the thermostat off, that's where women go, oh my God, I'm boiling in here. And everyone else is shivering, wearing coats, right?
Right.
But there's a lot of other underlying things that women don't talk about, such as a loss of libido. Women stop showing an interest in sex. And part of the reason also is when the vagina no longer gets testosterone and estrogen, it loses its lubrication, it scars, and sex becomes uncomfortable. So then it's this sort of vicious cycle. The bladder needs estrogen. And so we see women get more urinary tract infections during menopause, more overactive bladders, and that by putting women on hormone replacement, we can actually improve some of those things. And then we have sort of the big ticket items that get affected. And we'll put that under the heart, the brain, the breasts, and the musculoskeletal system. And so all of those things get affected during menopause. And it's because of all these issues where women are truly getting misinformation and suffering because of certain media portrayals. And frankly, the medical community even gets this wrong quite often. And it's really a disservice to women.
So my dad was a practicing obstetrician gynecologist for almost 50 years. He has seen a great deal. So there was the period of time I know when hormone replacement therapy, or HRT, was very popular. It was the thing to do. Everyone was on it. And then there was a moment in time, I think I'm getting this right, when a particular study came out that threw everyone into a panic mode and then sent everyone thinking maybe HRT is dangerous, maybe we shouldn't do this, and then kept women from getting hormone replacement therapy. Mm-hmm. Can you speak to that and unpack some of that? Where are we now on hormone replacement therapy? Is it dangerous? What are the dangers? And also, what are the dangers of not doing some hormone replacement therapy? Because I am tired, I think as a woman and as a 29-year-old woman, plus a few years, I'm starting to hear from doctors those horrible words, well, that's just part of aging, as though there's nothing to do and you have to accept certain things for the rest of your life, which I think sucks and doesn't seem to really be the case. But a lot of people are not wanting to give us any avenues for improvement. I mean, hair loss, all these other things that are happening. Is this the way it has to be? Go. Go.
Folks, she's not just a pretty face. She is a strong, independent, brilliant woman.
I paid him $20 to say that.
I mean that sincerely. I didn't even coach her through half that. I was sitting back on, damn, she knows this. But again, the daughter of an OBGYN. Yes. And hello, Dr. Dent Williams. You are my hero, and hope one day to be you when I grow up.
He's the man.
So yes, boy, a lot to unpack. Let's start at the beginning. So yes, it was normal for many, many years of your father's practice to put women on hormone replacement therapy. It was okay. You're starting to have these hormonal changes. Let's replace them. And it kind of makes sense, right? I mean, if your body is used to hormones being here and then you're at zero, you ain't going to feel that great.
So you should put them back.
Right.
Can you put them back?
So here's what happened. In 2002, the results from a study called the Women's Health Initiative study were published, or the WHI. And this is without a doubt the most misinterpreted study that is in the medical literature. I can't think of another study, and I'm not by any means an academic or a research geek, but even I know this, that was misinterpreted. So first off, it was a good study, for the time, and it probably is never going to be replicated because of the cost associated with it and how many years we would have to follow people. And maybe one day we will, and maybe there's some people out there who are replicating, and we'll get better answers. But for the time being, for the past 22 years, this is what's dictated how we view menopause and hormone replacement therapy.
Okay.
So again, the problem wasn't with the study, it was the interpretation. So what they did was they took women who were already well into menopause. Okay.
Already in it.
I
Okay.
believe the average age, and please, people don't hold me to this, but I think it was in their mid 60s. Okay.
That's pretty far down the road.
Likely a decade plus into menopause. And women who also smoked and weren't necessarily, models of health per se. And they put them on either placebo, which is a sugar pill, or they put them on estrogen alone, or they put them on estrogen and progesterone. Now, progesterone is the balancing hormone to estrogen. So one thing that we know beyond a shadow of a doubt, this is true, this is not a myth. If you have a uterus and you give women unopposed estrogen, you can cause endometrial cancer. So how did they decide whether a woman got estrogen or estrogen and progesterone? Well, did she or did she not have a uterus? So again, it wasn't a woman's choice. It was, if you had a uterus, you had to take progesterone, because if you take both together, it's sort of the balancing hormone. Estrogen stimulates the proliferation or growth of the lining of the uterus. Well, if we do that without opposition, because we no longer have progesterone post-menopause, it could lead to cancer. But as long as we balance it with progesterone, all is well, the uterus is happy. So we have these three groups. Now, interestingly, and this always comes up from people today, so what types of estrogen and progesterone? So first off, there's many types of estrogen. Okay. Estradiol is the most common one that's used. And in this case, it was Premarin. Premarin got its name from pregnant mare urine. So that's right, people. Premarin was formed from the urine of pregnant horses. Now, we now, in today's day and age, offer something called bioidentical estrogen. So we actually can use plants and form estradiol from all natural ingredients.
Does that mean that estrogen, the bioidentical estrogen, is more closely what was originally in your body?
It does. Now, I certainly want to speak truthfully here, and I'm either going to upset one end of the
You're going to
crowd
upset
here.
someone.
I'm going to
Okay.
upset someone here. So let me say this: theoretically, it would make sense, right? If I put in something that's natural to my body, it should be safer or it should work better. We honestly don't have the data to say that with certainty.
Okay.
On the flip side, it certainly makes sense that if we're putting something that was made from a pregnant horse urine, is that truly the best data? And the answer is we don't know. So the other thing was they used something called a synthetic progestin. So it was not an identical progesterone, which is technically the hormone. It was a progestin. So they ran the study and followed women and ultimately stopped the study early. And what they found was that the estrogen and progesterone group had a higher rate of breast cancer. And they said a 25% chance of breast cancer, or 25% higher risk of breast cancer. We're stopping the study, and the media grabbed it, and all doctors grabbed it and said HRT is bad.
Well, an HRT can give you breast cancer. I think that was the
Correct.
conclusion that everyone drew, and are still to this day. When you mention it to a lot of people, they say, oh no, that gives you breast cancer.
Yep. And so here's the actual, if you look behind the scenes, okay? And this is where it's so important for people to really understand some basic statistics. I think we can all agree in today's political climate that people don't know statistics on either side of the aisle, and quote these things. And it's like, where's your data from and how are you interpreting it? So we have to understand the difference between absolute risk and relative risk. So
Okay.
what's the difference? A absolute risk in the study was that the women on the sugar pill had 4 out of 1,000 chance of getting breast cancer. The women who received the estrogen and the progestin, it was 5 out of 1,000. So one more woman out of 1,000 women was diagnosed with breast cancer. One. But if you go from an increase of 4 to 5 and you do some math, okay, 1 over 4 equals 25%. 25% increase.
But that's not really
It is
it is
the relative
numerically
risk.
correct.
It's numerically correct, but it's not clinically significant. And not only that, they've never shown that it was a more fatal sort of breast cancer. Because again, we know in the prostate cancer world, there are plenty of prostate cancers that don't kill people. We know from plenty of breast cancers that when you get to them early, they are highly curable. So that alone then has shut down for decades pretty much all HRT in women by most traditional healthcare professionals.
But here's my question back to that number very quickly. So you just told us there were, and I'm not a medical professional, so bear with me. 4 out of 1,000 in the placebo group, 5 out of 1,000 in the progestin and estradiol group.
Yep.
One difference. Where was the data and what data did they submit to show that the one person, it was linked exactly to the drug?
So the way scientific studies...
That wasn't a good way to say that.
Yeah, no. So the way
I mean?
scientific studies work is you want to have enough study participants to make sure that a study is appropriately powered. Again, this is back to all the statistic days. So, right, if you take 10 people off the street and divide them in half and give a treatment effect, and you don't show a difference, it doesn't mean that the intervention wasn't going to cause a difference. You maybe just didn't study it in enough people. So we know it was a real difference because it met that requirement of, a p-value less than 0.05, meaning there's a 95% certainty the effect we're seeing is related to the intervention, which in this case was receiving the HRT.
So it wasn't something where you could have related the one extra person to an outside.
No, that's the whole point of these studies is they control
obesity,
for that.
diabetes,
They control for all that,
heart
right.
disease,
No,
something else.
We're talking about removing all confounding factors, all of that. So here's just a couple interesting caveats. So in the estrogen group alone, so the women who only got estrogen, so they didn't have a uterus and they just got estrogen. And we also have studies showing this in women who get testosterone and other things, that estrogen is actually protective against breast cancer. Wow. I want to say that one more time for everyone to hear. Estrogen alone can actually prevent and protect you from breast cancer.
But is that only for a woman who has no uterus?
Well, so that's right. So that's the caveat there is you're never going to give a woman just estrogen if she has a uterus. So again, we unfortunately don't have those studies that definitively answer that. But we believe the culprit when all is said and done, and if we also look at the stroke and blood clot and heart attack data, probably the culprit are these synthetic progestins. That seems to be the bad actor. If you really do a deep dive into this literature, that seems to be the one that plays a big role. So I think, one of the big take-home points we want to make from today is that ultimately you want to do an individual risk assessment for women when you're considering hormone replacement therapy. I think if you remember nothing else, again, you want to go do deeper dives into these studies, the statistics. I've got some more numbers here I can rattle off, but forget it. The fact of the matter is that there are risk calculators we can do based on your age, your history and risk factors for breast cancer, your history and risk factors for heart disease, and determine is HRT something good. But for the most part, what we've got to move away from is this all-encompassing blanket statement of HRT is bad and causes breast cancer, strokes, heart attacks, and blood clots. It is simply false to make that statement across the board. And if anything, we have data showing in other big studies, HRT actually reduces all-cause mortality in a lot of these groups in women. And so the answer is it's very complex. We got to look at it as an individual. It matters what age you start hormones. It appears that the earlier you start it in the perimenopause, early menopause years, the greater the benefit. Mm-hmm. It does appear that if there's any negative effect with hormone replacement therapy, it's if you start it much later in life. Okay, but again, not all or nothing. And that, ultimately we've got to look at it from an individual level. And we also can't ignore some of the other benefits of HRT.
Such as?
So the biggest one is bone and muscle health. So we get all emotional, and as we should, as someone who's lost a dear friend to breast cancer, we get all emotional over the C word. But if we look at, as we get older, what's more likely to cause us harm, it's actually, especially as a woman, it's osteoporosis and dying from a hip fracture. If you are over the age of 65 and you have a hip fracture, there's about a third to a 50% chance you will not be with us in a year. That is how morbid and how significant hip fractures are in elderly folks. And the best protector of bone health, without a doubt, is estrogen. So we're trading off this 1 out of 1,000 concern over breast cancer, this, again, concern over heart disease that doesn't hold water for a lot of women, especially women who take good care of themselves. And yet we're allowing these women then to develop brittle bones, lose all of their muscle strength, and deal with falls. So that's one big one. I think the other big one that we see is, potentially the role with Alzheimer's dementia. And again, this is not something definitively shown, but very interestingly, there are a number of studies that show the risk of Alzheimer's disease between women, men, and not only that, subgroups of women on or off HRT. And, interestingly, Alzheimer's is the one disease that occurs more often in women than men. And it's certainly not because of, you guys are clearly smarter than us.
That's true. That's obviously true.
If there's a half of the human race that's clearly better suited cognitively, it is not us as men. So the fact that women get Alzheimer's more, what do we relate it to? It's hormones. You go through 20, 30 years without estrogen and testosterone, and it plays an impact on the brain. And so, there's some data showing that as well. And then again, never mind the fact that you're suffering with a miserable quality of life at times. There's no sex life. Your bladder's not happy. So I think the summarization I'd like to make from my end as your neighborhood friendly urologist who also believes in wellness is HRT is not bad across the board. Please go and get it checked out. And I hope that you and other loved women in my life, aunts and stuff, don't worry about that. That came
whenever
across really
I
poorly.
reach 30.
whenever you get to that age in a while.
Not soon.
And I'm in the nursing home. I hope you consider HRT. It really is that important. And it's something that, again, I'm on a mission to just build awareness about, because there's just, again, too many women suffering in silence, going back to earlier themes.
And too much information that has, as you've said earlier, been wildly misinterpreted.
Yeah, listen, it's a sexy headline to go say, HRT causes breast cancer. Where's the sexy study that's come out since then to go, actually, we got it wrong. Hey, women, you should go get this checked out. Like, why are we not having that discussion? That is really upsetting to me that doesn't get pressed, but that did 22 years ago. And I still have women to this day come in, and I can't even convince them to be on vaginal estrogen cream. It's
too afraid.
Too afraid.
Because we have been told for so long, this causes breast cancer. Period. The end.
Yep. It's the biggest disservice we have done to women's health is the misinterpretation of the Women's Health Initiative. And there's other champions out there who are have bigger platforms than we do here. But hopefully for all of you listening and watching, we've changed your mindset on it. We'll at least talk to someone you trust about it.
Well, and I think we should do another episode where we talk even more about menopause and hormones at a later date. But for now, we'll wrap up in my favorite segment, Just the Tip. So, the takeaways from today. Number 1, menopause is a certainty, but living with these terrible side effects simply doesn't have to be. It is not just getting older and there's nothing you can do. Number 2, HRT, hormone replacement therapy, does not definitively cause heart disease or breast cancer in all women. And number 3, an individualized assessment is best for everyone. Go in, talk with your doctor. We are all very different.
Well said.
I'm smart.
Well, Kat, as always, it's been my pleasure. And to all of you, the members of our stream team, thank you so much. It's really an honor to sit in these chairs, and hopefully you've shared a laugh with us and learned something. So we would love some comments. We've got an episode coming up on an Ask Me Anything, which I'm really excited about.
Hold on to your hats.
And so we'd love to do that more often. And so please comment and subscribe and
send us very lurid and embarrassing and weird questions.
Yes, there's nothing. If we're urologists, we got to have fun. So
send it in.
There's nothing that is taboo, and we'll keep you anonymous. So with that, please, until next time, show yourself some love and grace. We're all works in progress, and these are opportunities to grow and improve. Thanks, and have an awesome day.
Thank you for listening to this week's episode of Balls Deep. If you'd like to join our stream team of listeners, please click the subscribe button on your favorite podcast platform. For more information about our practice, Pazona MD, please visit pazonamd.com. This podcast is for informational purposes only, and the content is not intended to be a substitute for professional medical advice. The show does not constitute the practice of medicine. No doctor-patient relationship is formed through this podcast or any of the social media channels related to this show. The use of this information is at the user's own risk. Users should not disregard or delay in obtaining medical advice from any medical condition they have, and they should seek the assistance of their healthcare professionals for any such conditions.